Should the UK introduce a countrywide prostate screening programme for men? Well, today I want to tackle a question that men ask me quietly, privately, often with a little bit of fear. Should I be screened for prostate cancer? Should I have a PSA test? And that debate is now raging in the press. Then there are also those men who just stay quiet and ignore any suggestion that they may need a PSA, often at their peril. I get why this question makes men uncomfortable and why we're still debating it. Cancer, the prostate, PSA tests, biopsies, side effects. People don't want to talk about these. Men are notoriously bad at looking after their health and admitting that they might have an issue. They often ignore things, kind of ostrich head in the sand approach. And PSA is a messy area of medicine, full of strong opinions, confusion, and a lot of information, some of it outdated and still circulating. So let's break this down properly. No scare tactics, no oversimplifying, no sweeping statements, just the truth, the benefits, the risks, the myths, and modern reality, which, by the way, is very different to what it used to be 10, 15 years ago. Now, of course, there are risks, side effects, downsides, upsides, as with all areas of medicine. But the key, as always, is understanding them, weighing them up in your individual situation. So let's start right at the top. What screening actually is and isn't. When people say prostate cancer screening, they usually mean the PSA test, just a simple blood test. But let's make one thing clear from the start. PSA is not a cancer test, and so is not a routine screening test. It is not, therefore, a yes or no answer. It's a risk marker, nothing more, nothing less. Think of PSA, if you will, as a smoke alarm. Sometimes it goes off when you've just burnt the toast. Occasionally there's a really big fire and it doesn't go off at all. So before we even talk about whether men should be screened, we need to understand what the test does and doesn't tell us. Both are important. This is where a lot of fear and confusion comes from. People think that a raised PSA means cancer, end. It doesn't necessarily. It helps to consider if prostate cancer screening saves lives. The answer is yes, for some men, some. Screening can reduce your chance of dying from prostate cancer, especially if you're between 50 and 69, if you're a black man because your risk is significantly higher, if you have a father or a brother with prostate cancer, if you carry a gene like BRCA2. For these groups of men, the benefit is very real. PSA screening can catch aggressive cancers early at a stage where treatment is far more effective and less life-changing. So the benefit is definitely there, and it isn't small either. But that is only half the picture. So, if a PSA can save lives, why is prostate cancer screening not offered to everyone automatically? And by everyone, I mean men. Well, this is the current hot topic debate, and it has led to the question, why doesn't the NHS run a national programme for all men? The answer is that the risk of harm negates the benefit for all men. And this is where things get complicated. PSA isn't precise. It can be high for all sorts of reasons. If you have an infection, if you have prostate enlargement, if you cycle on a bike, even sex and ejaculating. A high PSA can lead to scans and biopsies that may not have been necessary. And a biopsy is not benign. Even though the technique has improved dramatically over the years and side effects are now much less common than they once were, they are still there, and they can include impotence, persistent pain, incontinence. And historically, and this is important, historically screening did lead to a lot of overtreatment for cancers that didn't need it. Men were having major surgery, radiotherapy for cancers that would never have grown, never spread, never threatened their lives. And those treatments carry real consequences: urinary incontinence, erectile dysfunction, bowel irritation, hormone disruption, life-changing outcomes for cancers that may never have harmed. This is why mass screening is controversial. It's not that screening doesn't work. It's that screening has risks as well as benefits, and we must weigh both sides honestly. And let's be honest, even breast screening treats 22 women for every one that really needed treatment. And this is an issue. It causes anxiety, stress, it changes behaviour, and it may shape life decisions that didn't need to be changed. But here is the good news. The world has changed when it comes to prostate. And for sure, this is the part almost nobody talks about. And I too have been guilty of this. You know, it's very easy as a doctor to get caught up in things. Modern prostate cancer care is nothing like it used to be. 20 years ago, a cancer diagnosis meant immediate treatment. Now, the majority of men with low risk prostate cancer go into active surveillance today. Essentially, we just keep a very close eye on it. We use the tools that we now have, regular MRI scans, regular PSA checks, repeat biopsies if and when needed, and treat only if things genuinely start to change. This massively reduces the harm that used to come from overdiagnosis using a PSA. And this is why the conversation today is not the same as it was a generation ago. And that's the beauty of medicine. Things change over time with more information and more study. Screening is definitely safer now because treatment is smarter. The two go hand in hand. So right back to the start of this, guys. Should you be screened? Well, let's break that down properly. Instead of a one-size-fits-all answer, let's go through the groups. Group 1, men aged 50 to 69. For you, PSA screening is absolutely reasonable. This is the age group where screening has the most proven benefit. Group 2, black men. Your risk of prostate cancer is roughly twice that of a white man. Your risk of dying from it is also higher. So you should seriously consider starting screening and even younger at around 45. Group 3. If you have a family history, if your dad, your brother, son had prostate cancer, your risk is much higher. So start the conversation early again. Around 45 is sensible. And then group 4, BRCA, BRCA mutation carriers, especially BRCA2. This significantly raises your risk and screening from 40 is appropriate. Group 5, men over 70. If you're healthy, active and could easily live another 15 years, then screening might still make sense. If you have significant health issues or a shorter life expectancy, screening is unlikely to benefit you in this age group. And as with all medical decisions, we as doctors and patients need to consider that nuance matters. And we need to have what may be difficult conversations about life expectancy and the value of treatment. Would you treat a cancer, for example, in someone who has a year of life left? Screening isn't good or bad, and often it isn't perfect, but it is personal. So in summary, let's look at the myths, and these are the biggest ones. Myth 1, a PSA test means you'll be pushed into treatment. Not anymore. Active surveillance has changed the landscape of this completely. Myth 2, PSA is useless. It's not useless, it's just imperfect. There's a difference. Myth 3, a raised PSA means cancer. Absolutely not. Most raised PSAs are not cancer. Myth 4, a normal PSA means you're safe. Unfortunately, no. PSA can be normal even when cancer is present. And this is why trends over time matter more than just one number. And let us not forget, someone who doesn't have cancer today can develop it tomorrow. And then number 7, the UK's approach, informed choice. Here's where the UK actually gets it right. The NHS doesn't force screening and it doesn't ban it either. It gives you, men, the option, informed choice screening. Any man over 50 can request a PSA test after a proper conversation about the pros and the cons for you individually. Higher risk men can start earlier. The key thing is that you should be making the decision, not the government, not the media, and not fear. My professional view and my message to the men in my life, I see too many men who leave things, all other health issues and this, far too late. Men who will check their car engine light immediately, but will ignore their own body for years. Screening is not perfect. It definitely has risks, but so does doing nothing. So, if you're in the at-risk groups, again, they're age 50 to 69, black men, a family history, or a gene, screening could genuinely save your life. Not metaphorically, literally. And if you're not sure, go and have your conversation with your GP. That's what we're there for. You're not committing yourself to anything, biopsies, blood tests, surgery, nothing. You're simply choosing not to bury your head in the sand and having a conversation which you may decide to act on or you may not, and either decision is equally valid. A final word, should we screen nationally for prostate cancer? I'm going to say not blindly, not automatically, and not never. But informed, personalised screening done properly with modern MRI technology, better diagnostics, thoughtful monitoring can make a real difference. You should take control. Know your risk, understand the test, ask questions, make a choice that's right for you. Not a choice from fear, not a choice from denial. And if you want, I can do a follow-up vlog on PSA levels explained, symptoms men should never ignore, what happens actually during an MRI or a biopsy. Just tell me in the comments if this would be useful. And in the meantime, hit like and share. And hopefully, men out there, this has got you thinking, or the women in your life who will prod you too. Thanks everybody, take care.